Huang Tu Tang, commonly translated as yellow earth decoction, is a classical traditional Chinese medicine formula in the category warm yang and stop bleeding. Its core action is to warm yang, strengthens the spleen, nourishes blood, and stops chronic bleeding. The pattern framework is spleen yang deficiency with failure to contain blood. This mini-lecture focuses on the formula logic, recognizable pattern features, and practical drug-herb interaction screening. It is an educational overview, not an instruction to self-prescribe. Start with the pattern rather than the disease label. The traditional target pattern is spleen yang deficiency with failure to contain blood. Typical clues include chronic blood in stool, vomiting blood in classical descriptions, cold limbs, pale complexion, pale tongue, deep weak pulse. These findings are not all required, and the same biomedical diagnosis can present with different Chinese medicine patterns. Conversely, these traditional signs can arise from multiple biomedical conditions. That is why pattern differentiation and conventional red flag screening should occur together. Key herbs commonly associated with this formula include Zhao Zin Huang Tu, Baizhu, Fu Zai, Yi Jiao, Huang Qin, Sheng Dai Huang, Gan Kao. In classical formula analysis, some herbs address the principal mechanism, others support the chief action, and others harmonize or direct the prescription. The exact composition can vary by lineage, manufacturer, granule concentration, and modification. For interaction analysis, the actual ingredient label and dose are more important than relying only on the traditional formula name. The first interaction focuses food eye and cardiac medicines. Processed aconite is pharmacologically potent. Aconite alkaloids can cause ventricular arrhythmias, hypotension, neurologic symptoms, and life-threatening toxicity if processing, dose, or identification is wrong. Combining it casually with antiarrhythmics, digoxin, stimulants, or other agents affecting cardiac conduction is unsafe. Professional sourcing, correct processing, and close supervision are essential. In practice, ask what prescription drugs, over-the-counter products, supplements, alcohol, caffeine, and other herbal formulas the person uses. A multi-herb product can create several overlapping mechanisms at once, so medication reconciliation is a core safety step. The second interaction focuses Gan Kao and electrolyte-sensitive drugs. Licorice-containing formulas deserve attention during sustained or high-dose use. Glycyrrhizin can produce a mineralocorticoid-like effect in susceptible people, with sodium retention, blood pressure elevation, and potassium loss. That can matter with loop or thiazide diuretics, digoxin, corticosteroids, antiarrhythmics, and existing hypertension. The risk is dose, duration, and patient dependent. The quality of evidence for herb-drug interactions ranges from pharmacology and case reports to controlled human data, and that evidence is uneven. Therefore, distinguish a proven contraindication from a plausible additive effect, and use monitoring where the uncertainty is clinically meaningful. Safety summary. Contains processed aconite in the classical formula. Incorrect species, processing, or dosing can cause dangerous cardiac and neurologic toxicity. Unexplained, heavy, recurrent, gastrointestinal, urinary, or uterine bleeding requires biomedical evaluation rather than symptom suppression alone. Also verify species identity, processing method, contamination testing, and manufacturer quality. Stop and seek appropriate care for severe or rapidly worsening symptoms, allergic reactions, fainting, chest pain, major bleeding, neurologic deficits, or other red flags. Pregnancy, breastfeeding, significant kidney or liver disease, and polypharmacy warrant a lower threshold for professional review. A useful clinical checklist has 5 steps. 1. Confirm the traditional pattern. 2. Identify the exact product and full ingredient list. 3. Reconcile prescriptions, over-the-counter drugs, supplements, and other herbs. 4. Identify measurable endpoints, such as blood pressure, glucose, inner, electrolytes, symptoms, or bowel function when relevant. 5. Reassess after starting, stopping, or changing the formula rather than assuming the response will be stable. In summary, Huang Tu Tang is best understood as a pattern-based prescription whose action is to warm yang, strengthens the spleen, nourishes blood, and stops chronic bleeding. The key safety principle is targeted interaction screening plus objective monitoring when risk is plausible. Standard references for further study include Chinese herbal medicine formulas and strategies by Bensky and colleagues, Chinese medical herbology and pharmacology by Chen, and current drug interaction and pharmacology references.